Hello, my name is Shelby Richards, and I chose anxiety disorder as my mental health topic to discuss. I chose anxiety disorder for my contemporary mental health topic because although it is one of the most common and talked about illnesses, I still believe it's overlooked in our society. It is a hard illness because in some cases it can be very small and minimal, and it can come at random times for only a short period. Some people feel it in different ways. Some people feel just general stress, and for other people, it can be really hard. So for me, I struggle with anxiety periodically, but it's not something that I'm constantly struggling with every day. But I know a lot of people that do struggle with it every day, and to the point where it's almost ruining their lives because they feel that they can't do the things that they could do without the anxiety that they experience. This is the reason I chose this topic. It's something that comes in so many different shapes and forms, and as a future nurse, I would really like to be able to recognize that illness in all of its shapes and forms and be able to help that individual no matter what they're experiencing at that time. So there are lots of impacts to the healthcare quality and patient outcomes that we want to see with anxiety. One of those are being the patient maintains their anxiety level at a manageable level, which may look different in the patients that we see because, like I said earlier, some patients experience very minimal anxiety for just a short period of time, and other patients, it's a chronic illness that they experience very frequently. So a manageable level for them may look different depending on kind of what they need. The second outcome would be patient demonstrates use of more adaptive coping strategies rather than their physical symptoms in response to those stressful situations. So, for example, they could recognize the patterns being the first step of the change process. The third is interacting appropriately with others and spend time away from the attachment figure to do so. So an attachment figure may be somebody like their significant other, their friend, their mother, somebody that they really just attach to. So that is the first step in helping the patient learn to interact with others, getting them away from that attachment that they're experiencing, and a presence of a trusted individual provides the security during the times of distress. So this would be positive feedback that encourages repetition. Small successes will gradually increase the self-confidence and decrease the self-consciousness. So the patient will feel less anxious in group situations, which is what we're aiming for. And then simple, realistic goals will provide opportunities for success that increase self-confidence and may encourage the patient to attempt more difficult objectives in the future. So we can start out small and build up to harder things for them. Lastly is patient discusses feelings of dread, anxiety, and so forth. So we really want to use therapeutic communication techniques. So now we will consider the patient, family, and even other healthcare professionals. So it can be extremely hard for the patient, not only them, but their family members and even their friends or significant others to deal with their anxiety. I know for me, it's really hard for me to see my friends and family struggle with anxiety and not really be able to manage that. So there's different variations of this, and it can be helped with, say, family therapy, things like that, because it's often found that there's an attachment issue with the mother, most often, but it can be other family members too. So the family influences that have demonstrated an increased risk for anxiety disorders in children include parental overprotection and insecure parent-child attachment, and also maternal depression. So that can sometimes the parents' fears can transfer over to the children, and that can be a big cause of anxiety. So we want to make sure that not only the patient is safe, but also their family members. And by doing family therapy can really accomplish that. For example, a parent who becomes significantly fearful and apprehensive when confronted with unfamiliar circumstances, this could be a job or residence change, it teaches the child that this is an appropriate response. Now we will review regulatory factors, including laws, policy, and even reimbursement factors that are identified with anxiety. There is a plan for reimbursement factors. Each state is actually required to submit a state plan whenever they decide to change or modify the eligibility criteria or the service coverage or qualifications that the state has. And these are sent directly to Medicare and Medicaid services for their review and approval. These plans are for service coverage, reimbursement, state program administration, and even the individuals that have Medicaid or Medicare and choose not to cover services defined as optional to the Medicaid program. Other laws and policies include the ADA and ACA Acts. So the ADA Act is the Americans with Disabilities Act. It was made in 1990 and amended in 2008. This policy establishes requirements for equal opportunities in employment, including state and local government services, public accommodations, and commercial facilities for citizens with disabilities, which includes mental illnesses like anxiety, and also addictions and things like that. The other one is the ACA Act, which is the Affordable Care Act of 2010. It is a broader movement that towards reforming healthcare systems and makes health insurances more affordable for individuals, families, and business owners. Living with people with mental health challenges or substance use disorders often have problems getting private health insurance, so this act was made to help them. Lastly is the Mental Health Parity and Addiction Equity Act of 2008. This requires the insurance groups offering coverage for mental health or substance use disorders to make these benefits comparable to general medical coverage. So deductibles, copays, out-of-pocket maximums, treatment limitations, and things like that. So for mental health or substance use disorders must be no more restrictive than the same requirements or benefits offered for other medical care. Now we will go over the financial cost that's affiliated with anxiety disorder. So an interesting fact that I came across while researching was an article posted in 1998 by Rice and Miller. They wrote that the total economic costs of mental disorders amounted to U.S. currency $147.8 billion in 1990. They say anxiety disorders are the most costly, amounting to $46.6 billion or 31.5% of the total cost in America in 1990. Other financial costs that are related to anxiety disorder can be medications, therapy, or even just appointments that are associated with these illnesses. So many medications are used to manage and treat anxiety, including benzodiazepines, which can range greatly in prices. They can be extremely pricey depending on what kind of insurance coverage that you have. Another cost that's affiliated with anxiety can be therapy. I know many people use therapy as a resource to help manage their anxiety, and it can be a great resource to learn different coping strategies and talk out the emotions that are behind the anxiety issues. These appointments can also be extremely costly. I know sessions around the area that I live in can range from $100 to $200 per hour. And depending on how often you're needing these therapy appointments, that can add up very quickly. Lastly, anxiety can be sending you to your doctor extremely often, depending, like I said, on how often you experience anxiety. You may only need to see your doctor once a year. Some people may go once a week. And when you're first starting your medication therapy, it can be really hard to find the medication that suits your needs. So you may be visiting the doctor for follow-up appointments or just medication follow-ups quite frequently. So depending on how often you're going to the doctor and depending on your insurance coverage, that can add up very quickly as well. There could even be visits to the emergency room if a patient is experiencing an anxiety attack or other complications that they may have due to their anxiety. And these visits can be extremely pricey also. Emergency room visits are not cheap, especially if you don't have full coverage insurance, and all of this can add up extremely fast. And finally, we are going to be discussing how nurses can engage in social justice advocacy with or on behalf of their patients that are experiencing anxiety. So one of the first things I chose was speaking out about anxiety as a nurse. By doing this, we can help people understand that many people experience anxiety in all different shapes or forms, like I mentioned before. By doing this, we can start to normalize anxiety and help our patients feel like they're not so alone in what they're experiencing, as it can be really hard as somebody dealing with anxiety to understand that, there's other people that are dealing with this, and by doing that, it can help them feel better. Another thing we can do is maintain patients' privacy. This is not only the most important factor in being a nurse as maintaining privacy and following HIPAA, but we just want to make sure the patients are aware that we're maintaining their privacy, because although some people experience anxiety and may feel shameful because of it, it's not a shameful thing, although they don't know that because they're currently experiencing it. And we still need to provide that privacy for them and make sure they feel safe talking to us. Another thing that we can do as nurses for our patients is sign petitions and be an advocate for lowering costs of the medications, therapy, and just basic healthcare needs for our patients that are experiencing mental health issues like anxiety. Again, another thing that we do as a nurse that we will do with every patient we see is using therapeutic communication. This is something that can be helpful in patients that are experiencing anxiety, because it's a tool that we can use with patients and also their family members, and it can be very important to use different tools for therapeutic communication, such as reflecting, restating, exploring, using active listening, and even asking open-ended questions. Using these will help learning more about our patient and being able to provide the care that they need specifically. Educating our patients about exactly what anxiety is, how to manage it, some signs and symptoms to watch out for, just going over their medications, the side effects that they might have. By doing this and educating them, they can make better informed decisions about their own health care and may even feel more comfortable with their diagnosis. Lastly, and one of the most important factors that I feel is important with anxiety disorder, is giving our patients many outlets and resources that they need. So by always giving our patients multiple resources, they will be much more likely to find something that works for them, because the same resources aren't always a match for every patient. And by providing multiple, it makes them much more likely for a patient to find the resource that will help them specifically, because they can go through multiple things, and if that doesn't work, they can try something else until they find what meets their needs. And that's it. I hope in the future, when I am a practicing nurse, that I am able to help my patients with anxiety, no matter if it's big or small, anything that I can do to help them. Yeah, thanks for watching.